the medical concerns that Reverend King brought up, here we have with us today a local doctor by the name of Dr. Lee Fentress. Fentress. Sorry about that.
I would welcome him to come up here with me, but I guess we all get our turn. It's great to be here. I see a lot of familiar faces in the crowd, which is always a wonderful thing, and I think that is a great thing about Nashville. So I am a physician here, and I practice internal medicine at Heritage Medical Associates right here in Nashville. I'm the immediate past president of the Nashville Academy of Medicine. I'm the current chairman of its board of directors, and I'm a delegate to the Tennessee Medical Association's delegation. This past year, I helped with some friends of mine create a nonprofit that provides free, long-acting, reversible contraception to any woman in Davidson County and its neighboring counties. I'm glad to hear that applause. But most importantly, however, I am a physician that practices medicine every day. I take care of patients in the office every day. I'm not an administrator. I'm not a politician. I've seen the immensely positive impact the Affordable Care Act has had on preventative services for my patients, which are now covered without any out-of-pocket expense to my patients and everyone's patients and everyone. One of the most successful components of the Affordable Care Act and of those preventative services is that the ACA mandates full coverage of all forms of contraception. We know that when women can obtain an education and enter the workforce before having a baby, the result is healthier women, less poverty, stronger communities, and when the woman is ready, healthier babies and happier families. Stopping the cycle of poverty has far-reaching effects on not only the individual women and their families, but on our local, state, and national communities and their resources. In Tennessee, in 2010 alone, $530 million in taxpayer money was spent on unintended pregnancy. But in recent years, we've started to close that gap, in large part due to the coverage of contraception. Prior to the Affordable Care Act, coverage for the most effective form of contraception left women responsible for a large part of the cost through high copays and deductibles. Many women were unable to afford this cost, resulting in more unintended pregnancies. Last week I was talking with a young woman who was in an addiction treatment program and was very interested in obtaining an IUD, as it would be a single intervention that would provide uninterrupted contraception for at least 5 years. She appropriately wanted this to happen in just a few days as opposed to waiting until she finished treatment, because as she said, a lot can happen in a month. We, like she, do not have a month to spare. We cannot allow such services to be ripped away while we sit around for months, if not years, waiting for a replacement plan.
At least $1,300. And I wept that day, not just for my daughter and the path that her life was going to be going down, because it's very difficult for her to manage her diabetes every day, but for all of those families that get that kind of news and don't have the kind of coverage that we all need. This child, when she gets to be of age, should be able to buy health insurance coverage for herself. But prior to the ACA, insurance companies would have told her, sorry, we won't insure you. Your pre-existing condition is not our concern. So this is a matter of life and death for so many Tennesseans, including my daughter. Thank you so much for everything you're doing.
Thank you, Chief of Staff. Thank you so much.